You know that moment when the vet gives you test results and suddenly you're hearing words you've maybe never encountered before.
Yeah.
Maybe you've had your pet's urine checked and the term glucosuria popped up. It might sound complicated, but trust us, we're going to break down exactly what it means when glucose, that sugar, shows up in their pee.
Exactly. Yeah, we've been looking closely at some, detailed veterinary guidelines on this. And what's fascinating is that this seemingly simple finding, sugar in the urine, can actually be a clue to a lot of different things happening inside your animal.
Right.
So our goal today is really to take that technical stuff and explain it clearly so you understand the potential causes and what it all means without feeling like you need a medical degree.
Perfect. So let's get right to it. What is glucosuria in, like, plain terms?
Okay, so in simple terms, glucosuria just means that a standard urine test, the kind using those little dipsticks, it's detected a noticeable amount of glucose in your pet's urine. Now, there's usually a very tiny amount of glucose present, kind of like background noise, really low levels.
Okay.
But these standard tests shouldn't really pick it up. So if they do, especially if it happens consistently, it's generally a sign that, oh, something's off.
Okay, so normally, our furry friends aren't just letting sugar go to waste in their urine. How does their body usually keep that from happening?
Yeah.
What's the normal process?
That's a really important question, actually. So when blood flows through the kidneys, glucose is freely filtered out, along with waste products, into what will eventually become urine. Think of the kidneys like a really sophisticated filter.
Right.
But then, in these tiny tubes within the kidneys, the proximal tubules, there's this super efficient reabsorption system at work.
Wow.
Special transporters, they actually use sodium. They grab that glucose and actively pull it back into the bloodstream. It's sort of like a recycling program specifically for sugar. And in a healthy animal, this system is so good that almost all the filtered glucose gets reabsorbed. So you end up with practically undetectable levels in the urine.
Got it. So if sugar does show up, something must be disrupting that recycling process.
Yeah.
The guidelines we looked at mention hyperglycemic glucosuria. What's the story there?
Right, hyperglycemic glucosuria. That's actually the most common reason we see glucose in urine. It's basically a case of too much sugar, too much glucose in the bloodstream for the kidneys to handle.
Okay.
Think back to those transporters we just mentioned. They have a limit. There's only so much glucose they can grab and pull back in a certain amount of time.
Like a maximum capacity.
Exactly. It's called the renal tubular epithelial transport maximum, or just TIM for short. For dogs, that limit, that TIM, is roughly between 170 and 180 milligrams per deciliter of glucose in the blood.
Okay.
And for cats, it's actually quite a bit higher, around 260 to 310 mg/dL. So when the blood sugar level goes above these thresholds,
They transporters get overloaded.
precisely, they just can't keep up. They get overwhelmed, and the extra glucose that can't be reabsorbed spills over into the urine. That's what we detect as glucosuria.
Okay, that makes sense. Like a traffic jam on the sugar reabsorption highway.
Now, the guidelines also say this hyperglycemic type can be transient or persistent. Why does that distinction matter?
Yeah, that's a really important distinction because it helps us figure out what might be causing the glucosuria. Is it just a temporary blip or something more ongoing?
Right.
So transient hyperglycemic glucosuria means there's been a temporary spike in blood sugar that led to the glucose spilling into the urine. This can happen for a few reasons.
Like what?
Well, one common one, especially in cats, is stress.
The vet visit effect.
Exactly. Think about a cat who gets really worked up going to the vet. Those stress hormones, things like adrenaline and cortisol, can temporarily raise their blood sugar quite significantly, enough to exceed that TIM-DOM threshold and cause glucosuria.
And interestingly, the blood sugar level that you measure right then at the clinic might even be normal or only slightly high.
Okay.
Because the urine that's in the bladder, the sample you collect, might have been produced over the last few hours while the blood sugar was high, even if it's come down a bit by the time you take the blood sample.
Ah, I see. That's really good to know. So a one-time positive might just be vet visit nerves, especially for cats. What else can cause these temporary sugar spikes?
Well, certain medications or medical treatments can definitely do it. Things like intravenous fluids that contain glucose, like dextrose solutions,
Makes sense.
or certain drugs and hormones. Glucocorticoids, steroids are a big one. Also ACTH, glucagon, adrenaline, progesterone. Even some sedatives, particularly xylazine in cats, can cause a temporary spike.
Wow.
And then there are, unfortunately, some toxins like ethylene glycol that's antifreeze, which is really serious.
Oh, yeah.
And even some sudden health issues like a bout of acute pancreatitis can sometimes trigger a temporary hyperglycemia and subsequent glucosuria.
Okay, so that's quite a list of potential short-term reasons.
Yeah.
But what about when it's persistent? When it keeps showing up? What's usually the underlying issue then?
Right, persistent hyperglycemic glucosuria. This is where the glucose keeps showing up in the urine samples over time. And this is generally more concerning because it often signals a more significant, ongoing, underlying health problem.
And the main suspect is?
The most common culprit here, by far, is diabetes mellitus.
Okay.
In fact, it's present in the vast majority of cases of persistent hyperglycemic glucosuria. If you keep seeing glucose in the urine alongside high blood sugar, diabetes is usually top of the list.
What else could it be, though?
Other potential causes include hormonal disorders like hyperadrenocorticism, that's Cushing's disease.
Yeah.
And then there are some rarer conditions like pheochromocytoma, which is a tumor of the adrenal gland, or glucagonoma, a pancreatic tumor, or acromegaly, which involves excess growth hormone. High levels of progesterone, either naturally produced or from medication, can also contribute. Even prolonged periods of extreme stress, chronic liver disease, and in very rare instances, certain problems in the central nervous system, like brain lesions, could potentially play a role.
So finding glucose repeatedly really signals that, yeah, you need to dig deeper to find that root cause, and often it points towards something like diabetes or Cushing's.
Absolutely. Persistent findings demand a thorough investigation.
So that covers the situations where blood sugar is high. Now, the guidelines also mention something called normal glycemic glucosuria. That sounds a bit contradictory, sugar in the urine, even when blood sugar is normal. How does that work?
Exactly. It does sound strange at first, doesn't it? Normal glycemic glucosuria happens when the problem isn't with high blood sugar overwhelming the system,
Okay.
but rather with the kidney's ability to reabsorb glucose properly, even when blood glucose levels are totally within the normal range.
So the filter is fine, but the recycling system is broken.
That's a great way to put it. The issue lies specifically with those transporter proteins in the kidney tubules we talked about earlier. They aren't doing their job effectively.
And what kind of things can cause this kidney-specific problem? Can pets be born with it?
Yes, it can be something the animal is born with, which we call congenital, or it can be something that develops later in life, which is acquired.
Okay, what are the congenital causes?
Well, one specific type is called primary glucosuria. It's known to occur in Scottish Terriers, for instance. It's often found just incidentally, maybe during routine testing, especially if the test is done after an overnight fast. They just leak glucose, but otherwise might seem fine.
Interesting.
Then there's a more well-known condition called Fanconi syndrome. This affects several breeds, but it's most famously associated with Basenji dogs.
Ah, I've heard of that.
Yeah, but it's also seen sporadically in other breeds like Norwegian elk hounds, Shetland sheepdogs, miniature schnauzers, labs, border terriers, whippets, Yorkies, even mixed breeds sometimes.
And Fanconi is more serious than just leaking glucose.
Yeah. Yes, Fanconi syndrome is a broader problem. It's a generalized defect in those proximal renal tubules. So they aren't just struggling to reabsorb glucose, but also other important things like amino acids, phosphorus, bicarbonate.
Oh, wow.
Yeah, so it can lead to issues with electrolyte balance, acid-base balance, and other complications beyond just the glucosuria. There are also some other rare congenital kidney diseases, like in Norwegian elk hounds, that might involve this kind of dysfunction.
Okay, so that covers being born with it.
Mm-hmm.
What about the acquired reasons? How could a pet develop this later on?
Acquired Fanconi syndrome, or similar tubular dysfunction, can be triggered by various things. Certain toxins are a major category, things like heavy metals, lead, mercury, cadmium, even copper accumulation in the liver in cases of copper-associated hepatitis can damage the tubules.
Ah.
And you might remember a while back there was a significant issue with certain jerky treats, particularly dried chicken treats made in China, that were linked to causing Fanconi-like syndrome in dogs.
Yes, I do remember that. That was scary.
It really was. Certain medications have also been implicated. Drugs like the antibiotic gentamicin, some cephalosporins, tetracycline if it's outdated, the chemotherapy, drug cisplatin, amoxicillin in some cases.
So medications are a possibility too.
Definitely. And even some chemicals like Lysol disinfectant or a substance called maleic acid have been associated with it. Less commonly, you might see it following acute kidney failure where the tubules have been damaged, or very rarely, even in some cases of chronic kidney disease.
It's really surprising just how many different things can disrupt this delicate balance of glucose handling in the body, either by raising blood sugar or directly affecting the kidneys. What kind of effects does this glucosuria actually have on different systems in an animal's body?
That's a good question. Well, with the normal glycemic type, the main impact is obviously on the kidneys and the urinary system because of that faulty tubule function.
Right, the kidney itself is the problem.
Exactly. And as we mentioned, Fanconi syndrome, being more generalized, can have wider effects, potentially leading to metabolic acidosis, electrolyte imbalances, and eventually contributing to chronic kidney disease that affects multiple body systems.
Okay.
But importantly, any situation where there's glucose consistently present in the urine, whether it's from high blood sugar or a kidney reabsorption problem, significantly increases the risk of bacterial urinary tract infections
Why is that?
because that sugar essentially acts as a food source for a bacteria. It makes the urinary tract a much more inviting environment for them to grow and multiply.
Ah, okay. That makes sense, like leaving sugar water out.
Pretty much. Then, in the hyperglycemic cases, the connections are strongly linked to the endocrine system, the hormone system, particularly with diabetes and Cushing's disease, as we discussed.
Right.
And with acquired Fanconi syndrome, especially if it's linked to something like copper-associated hepatitis, you can see significant effects on the liver. You might see changes in liver enzymes like ALT and ALP, maybe changes in bilirubin or effects on liver function tests like albumin or urea nitrogen levels, and potentially even problems with blood clotting.
So, yeah, it's definitely not just about sugar in the pee. It can really have knock-on effects in the kidneys, the bladder, the hormone system, even the liver, depending on the cause.
Absolutely. It's a finding that prompts a look at the bigger picture.
Does the age or breed of an animal give us any clues about what might be going on if glucosuria is found?
It certainly can. The signalment that's the age, breed, and sex can provide valuable hints. For instance, we see persistent hyperglycemic glucosuria most commonly in adult dogs and cats, simply because they're the age group most likely to develop diabetes mellitus or Cushing's. For congenital Fanconi syndrome in dogs, those clinical signs related to the poor reabsorption, like increased thirst and urination, often become noticeable when the dog's around, say, 4 to 5 years old. And it seems to affect males and females pretty equally.
And you mentioned Scottish Terriers earlier.
Right. For primary renal glucosuria, that specific type where they just leak glucose, it's often picked up much earlier, often incidentally, in young Scottish Terriers.
What about labs?
Labrador retrievers have a known predisposition to copper-associated hepatitis, which, as we said, can then lead to acquired Fanconi syndrome. So finding normoglycemic glucosuria in a lab might point you towards checking their liver copper levels.
Interesting connection.
And it's worth repeating that those contaminated dried chicken treats affect dogs of pretty much any breed or age, so history is key there too.
That's really helpful context to keep in mind. Now, thinking about it from the owner's perspective, what are some of the things you might actually notice at home if your animal has glucosuria? What kind of signs might make you think, maybe I should get this checked out?
Yeah, the signs can definitely vary depending on what the underlying cause is. But with persistent glucosuria, probably the most common thing owners notice is that their pet is urinating more often or in larger volumes. That's called polyuria.
Okay, why does that happen?
It happens because the glucose in the urine acts like an osmotic agent. Basically, it pulls extra water out along with it as the urine is formed. More glucose in the filtrate means more water gets dragged into the urine.
Osmotic diuresis.
Exactly, osmotic diuresis. And because they're losing more water through urination, they naturally get thirstier and drink more to compensate. That's called polydipsia. So increased urination and increased drinking, the classic PUPD, is a very common sign.
Okay, PUPD. Got it. What else?
Well, as we've mentioned a couple of times now, because of that increased sugar, they are more prone to urinary tract infections, or UTIs.
So you might see signs like,
You might see them needing to go outside more urgently or frequently, maybe straining to urinate, having accidents in the house, or maybe the urine looks cloudy or has a strong smell. So those are key things. And of course, telling your vet about your pet's breed and any medications or supplements they're on is always super important, as that history can provide vital clues.
absolutely. And what might a vet pick up during a physical examination? Does it differ much between the types?
It can. In pets with hyperglycemic glucosuria, say from diabetes or Cushing's, the physical exam findings often relate to that underlying disease.
Like what?
Well, a diabetic cat might be underweight, maybe have a dull coat, or even walk differently due to nerve issues. A dog with Cushing's might have thin skin, hair loss, a pot-bellied appearance.
Okay.
On the other hand, animals with normoglycemic glucosuria, especially early on or with just primary glucosuria, might actually appear completely normal on their physical exam.
Huh.
However, in more advanced cases, particularly with Fanconi syndrome where other things are being lost in the urine too, a vet might find subtle signs, maybe dehydration, weight loss, or signs that point towards problems with their body's acid balance or electrolyte levels, or even early signs related to developing chronic kidney disease.
So glucosuria can sometimes be a bit of a stealth finding, or it could be part of a much bigger picture of symptoms. How exactly is it detected in the first place? What are the tests involved?
Well, the first step is usually that routine urine screening test, the urine dipstick analysis, which, as we said, should normally be negative for glucose.
Right.
The most common type of test on those strips is the glucose oxidase test. It's pretty specific for glucose, which is good, and it's generally more sensitive than older methods, usually able to detect glucose levels once they get above, say, 40 to 100 milli-GDL in the urine, though it varies by brand.
How does it work?
Basically, the little pad on the strip contains enzymes, glucose oxidase and peroxidase, and a color indicator. If glucose is present, the glucose oxidase enzyme starts a reaction, which then leads the peroxidase to react with the indicator, causing a color change.
And you compare the color to a chart.
Exactly. You compare the color change on the pad after a specific time to the color chart on the bottle to estimate the amount of glucose present.
Simple enough, but you mentioned potential issues earlier. What about if the urine is, say, really dark yellow or reddish?
Yeah, that's a potential pitfall. Very pigmented urine, like if there's blood or bilirubin present, can sometimes stain the pad and make it harder to accurately interpret the color change for glucose.
Okay. And are there other things that could mess with the results of these glucose oxidase dipsticks? Could you get a false positive, making you think there's glucose when there isn't?
Yes, false positives can happen, although they're less common. It usually occurs if the urine sample gets contaminated with certain oxidizing agents, things like hydrogen peroxide or maybe residues from bleach or chlorine used to clean the collection pod or the floor where the sample was collected.
Ah, okay.
Yeah.
Good to know. What about false negatives? That seems more worrying, missing glucose when it's actually there.
Right. False negatives are definitely something to be aware of. One major cause is interference from ascorbic acid, which is vitamin C.
But pets make their own vitamin C,
Hmm.
right?
They do. Dogs and cats make their own. And high levels in the urine can sometimes interfere with the chemical reaction on the strip, especially if the actual glucose levels are only slightly elevated. It can basically stop the color change from happening properly.
So it looks negative even if there's some glucose.
Exactly. Some test strips, like the ChemStrip brand, actually contain iodate in the pad specifically to help counteract this vitamin C interference, which is helpful.
Okay.
But if a pet has ingested really large amounts of vitamin C supplements or maybe certain medications like salicylates, aspirin-like drugs, that could also potentially cause a false negative. Other things include testing a urine sample that was refrigerated without letting it warm back up to room temperature. First, the enzymes on the strip work best at room temp. Also, very high levels of ketones in the urine, sometimes seen in diabetic ketoacidosis, can occasionally interfere if the glucose level is borderline low. And even the urine concentration itself, its specific gravity, can sometimes affect the sensitivity, particularly with multi-stick strips, according to the guidelines. And of course, using outdated or improperly stored test strips, like if they've been exposed to sunlight, can lead to inaccurate results.
Wow. Okay. So it's definitely not always a simple positive or negative result you can take at face value. There are nuances.
Absolutely. A single urine dipstick result, especially if it's unexpected, often needs to be interpreted in context and sometimes repeated or confirmed.
Are there other types of urine glucose tests that vets might use? The guidelines mentioned copper reduction tests?
Yes, copper reduction tests like the Clinicians tablets are an older method. They can detect glucose, but they have some drawbacks compared to the enzyme strips.
Such as,
Well, they're generally less specific for glucose. They detect other reducing substances too, things like other sugars, fructose, lactose, large amounts of ascorbic acid again, certain drug metabolites like conjugated glucuronides, penicillins, sulfonamides.
so more potential for false positives.
Exactly. They're more prone to giving a positive result even if glucose isn't the cause. They're also generally less sensitive than the glucose oxidase strips, meaning they might miss lower levels of glucosuria that the strips would pick up. Their detection limit is usually around 250 milli-GDL.
So the dipsticks are generally preferred for screening then.
Yes, for routine screening, the glucose oxidase strips are usually the go-to because they're more specific and sensitive for glucose.
Given these potential inaccuracies with the urine tests, especially the dipsticks, are there more reliable or confirmatory tests vets might use if glucosuria is suspected or the result seems odd?
Absolutely. If there's an unexpected result, maybe a faint positive, or if the urine is really pigmented, making the strip hard to read, a vet can send the urine sample or a blood sample to the lab. Automated chemistry analyzers in labs use different, highly accurate enzymatic methods, like hexokinase or glucose dehydrogenase tests, to measure glucose concentration precisely. That can confirm if glucose is truly present and at what level.
Okay, that makes sense for confirmation. Now, beyond just checking for glucose in the urine itself, what other lab work is usually done if glucosuria is detected to help figure out the why?
Great question. A minimum database, which usually includes a complete blood count, CBC, a full serum biochemistry panel, and a complete urinalysis, not just the dipstick, but looking at sediment, specific gravity, etc., is almost always recommended.
And what can those tell you?
They provide a huge amount of information to help pinpoint the underlying cause. For instance, as we touched on, finding ketones in the urine, ketonuria, along with glucosuria and high blood sugar, hyperglycemia, is a classic sign of diabetic ketoacidosis, which is an emergency. Or seeing signs of inflammation on the CBC, maybe high white blood cells, along with elevated pancreatic enzymes like lipase or amylase on the biochemistry panel, in a dog with hyperglycemic glucosuria. That might point towards pancreatitis as the trigger.
Okay.
If you see markedly high alkaline phosphatase, ALP, on the biochem panel, along with hyperglycemia and glucosuria, and maybe high cholesterol or triglycerides too, that would definitely make you suspicious of hyperadrenocorticism or Cushing's disease.
And if it's just mild glucosuria with maybe only a brief spike in blood sugar?
Then, as we discussed, that's often attributed to transient stress, especially if the rest of the lab work is pretty normal.
So the basic blood work and urinalysis give a lot of clues. What about more specific tests to nail down those underlying conditions like Cushing's or Fanconi?
Yeah, exactly. If Cushing's disease is suspected based on the initial findings in a hyperglycemic dog, the next step would likely be specific endocrine function tests, like a low-dose dexamethasone suppression test or maybe an ACTH stimulation test.
Okay.
If, on the other hand, you have normoglycemic leukosuria, the focus shifts. Measuring the actual amounts of phosphorus, glucose, and amino acids being lost in the urine, often in samples collected over a specific time period, can be really important to differentiate between Fanconi syndrome, where multiple things are lost, and primary renal glucosuria, where it's mainly just glucose.
And for the acquired Fanconi?
Then tests looking at liver function, potentially checking copper levels via biopsy if copper-associated hepatitis is suspected, become crucial.
Does imaging play a role, like X-rays or ultrasound?
Imaging can be very helpful too. Abdominal ultrasound in particular is often used. It can help diagnose pancreatitis, look for changes in the adrenal glands suggestive of Cushing's disease, assess the liver, kidneys. It adds another piece to the puzzle.
Okay, so figuring out why glucosuria is happening can really involve several steps, from basic screening to more advanced tests and imaging. What about treatment and management? Once a cause is actually found, what's the general approach?
Well, as you can probably guess by now, the treatment really depends entirely on the underlying cause. There's no single treatment for glucosuria itself because it's a sign, not the disease.
Right, treats the cause, not the symptom.
Exactly. So if the glucosuria is thought to be caused by a medication that's maybe affecting kidney tubule function, the first step would obviously be to discontinue that drug if possible.
Makes sense.
For the most common scenario, hyperglycemic glucosuria due to diabetes mellitus, the entire focus of treatment is on managing the high blood sugar through insulin therapy, diet changes, and monitoring.
Okay.
For normoglycemic glucosuria, say like the primary type in Scottish Terriers where they're otherwise healthy, specific treatment for the glucose leak itself might not actually be needed unless complications arise.
But for Fanconi?
For Fanconi syndrome, management is more complex because you need to address the loss of other substances too. That might involve specific supplements to replace lost electrolytes or bicarbonate to manage acidosis, alongside addressing any underlying cause if it was acquired.
Gotcha. Are there any treatments that are generally not a good idea or contraindicated if an animal has glucosuria?
Yes, definitely. The main one is that in patients who are already diagnosed with diabetes mellitus, you'd want to be very cautious about using, or ideally avoid altogether, any drugs known to raise blood sugar.
Like steroids.
Corticosteroids are the classic example. Also, using intravenous fluids that contain dextrose should be avoided unless absolutely necessary for other reasons. You don't want to add more sugar to the system.
Right. And what are some of the potential problems or complications that can arise from glucosuria itself if it's not properly managed or the underlying cause isn't addressed?
Well, we've hammered this point home, but it's important that increased risk of bacterial urinary tract infections, cystitis, bladder infection, or even pyelonephritis, kidney infection is a major one. Sepsis is even possible if an infection gets out of control.
Because of the sugar feeding the bacteria.
Precisely. And other key thing is that osmotic diuresis, we talked about the constant loss of extra water leading to polyuria, increased urination. This means the animal must compensate by drinking more, polydipsia.
So they need water available.
Absolutely critical. They need constant access to plenty of fresh water. If for some reason their water intake is restricted while they still have glucosuria, they can become dehydrated quite quickly.
That's a really important practical point. Wow, this has been incredibly helpful in demystifying glucosuria. So to sort of bring it all together, what's the main thing you really want our listeners to take away from this whole discussion?
I think the key thing to remember is that finding glucose in your pet's urine is basically a signal. It's telling you something is up. It indicates that either the blood sugar levels have gotten too high for the kidneys to cope with,
Right, overwhelming the system.
or there's a problem specifically with the kidneys' ability to do their job of reabsorbing glucose effectively, even if blood sugar is normal.
Yeah, it's not a diagnosis in and of itself, right, but it's a really crucial finding that can point towards a whole range of underlying conditions. Some might be transient and relatively benign, like stress,
Exactly. While others can be much more significant and serious, like diabetes or kidney disease, requiring ongoing care and management.
which underscores why it's just so important to work closely with your veterinarian if this comes up. They're the ones who can do the detective work to figure out the specific reason for the glucosuria in your pet and then set up the right plan.
Absolutely. It needs proper investigation to get to the bottom of it.
Definitely. And maybe just to leave everyone with something to think about. Considering all these different factors we've discussed today, they can lead to something seemingly simple like glucose showing up in urine. What other basic lab findings, things that might seem straightforward on a report, could actually have surprisingly complex reasons behind them in our pets?
That's a great question.
It really makes you appreciate how intricate the body is, doesn't it? And it's a good reminder that there's often a lot more to a lab result than just the number on the page.